Thank you very much for a nice word. Hello, everybody. It's a really pleasure and honor to be here. Thank you. And I would like to say something about physical activity, but not only in diabetes patients, but also in everybody, because physical activity is the best thing you could do, except of diet, of course. And there are two main groups of diabetic patients, the obese one and the elderly people, and we would like them to have more physical activity than they actually have. So what is it about physical activity? There is, in a body, there is just a few systems which don't profit from physical activity, from regular physical activity. The main is joints. They quite suffer with obese people, but on the other hand, there are a lot of systems that benefit with large evidence from physical activity. It's a cardiovascular system, of course, metabolic benefits, and it also improves physical fitness and endurance, improves lung function, immunity system. It improves the sleeping troubles and prevent osteoporosis. I don't want to speak about social benefits of physical activity, and in elderly, the main thing is that the physical activity regular enlarge the function of the organism, and it extends the ability for self-care, which is really, really important for us in our internal department. And it also reduces incidence of incontinence, which is also important, and prevents sarcopenia. We will speak about sarcopenia because it's connected with nowadays trendy care with GLP-1 receptor agonist. I will tell you later. So there are large benefits of physical activity, specifically in diabetic patients. It lowers the HbA1c, which is the long-term parameter of diabetes, and it also lowers the blood pressure, cholesterol, and of course body weight. So regular physical activity lower the cardiovascular risk, cancer, morbidity, and mortality. But in elderly, the main focus is not to lose weight, but to improve function fitness, because they lose muscles and they lose function. So we force them to exercise. What is worth doing? It could seem that physical activity is a little bit ineffective in energy burn, and I will show you how many energy is burned during our everyday work. In occupation of doctor, we spend only 160 calories, which is not so much. It's almost the same as while seated, because we majority of time we sit. Nurse and dietitian has a little bit higher amount of calories burned per hour, and it's similar like slowly walking. 4 kilometers per hour is quite slow. And you could see that there are some activities like sport, which is more effective, but it's not easy to climb stairs for an hour. And you could see that in comparison with calorie amount that our patients consume, it's quite unbalanced, which is positively in energy intake than in energy lost. About the sport, cycling is quite effective, or light aerobic maybe, recreational football, running, but 8 kilometers per hour, it's already a decent run. It's not often seen in our patients. And mountain hiking, it's a recommended activity. Recreational swimming is quite fine for energy burn, because it's also in cold water, so the body spends energy for warming, and also intensive fitness. But remember, the hour of the exercise, it's quite a long time. But in comparison, if we or our patient eat something like that, and believe me, they eat this, it's horrible. It's like carbonara pasta, I think, or with Wiener Schnitzel maybe, and it's it's almost 2,000 calories per day, which is the whole day amount they should eat, so maybe more, and is definitely not the only meal per day for them. So what is it about? It is about a law of energy conservation, because we don't force them because of the physical activity itself, but we force them to exercise because of the basal metabolism. Basal metabolism rate burns almost 75% of calories. So we need to improve basal metabolism, and it's influenced by weight, height, age, gender, of course, some genetic factors. But the majority of basal metabolism is involved by the amount of muscle we have. So we need our patient, to change fat to the muscles, and the reason is they can burn more energy then. So the main idea is to force them for regular exercise, change them the fat to muscle, and because the muscle accelerates the basal metabolism, and the faster metabolism burns more calories. So that's the reason we force them to exercise. Because the activity, thermogenesis, the activity itself burns just maximum 30%. So the number I showed you before burns only 30%, and the majority of person burns the basal metabolism. So what is it about the basal metabolism? It depends on lifestyle and on regular exercise. And if we regularly exercise, we improve the basal metabolism, and then we multiply the basal metabolism by higher number, which consists of the activity we have. And I will show you some example, because it's better. You can see this is a calculator from internet. It's quite easy to download some calculator of basal metabolism. And if we put there some kind of numbers, for example, like for these two girls, you can see that they have the same height, the same weight, but their body composition is quite different. And this girl has the 65 kilos, and her body composition and her basal metabolism is around 1,400 calories per day. It's basal metabolism. But for this girl, because she has much more muscles than that one, we used indirect calorimetry for this type of girl, and her basal metabolism was this high. And if we count the difference between these two metabolisms, this girl could eat with no gain of weight. For example, this hamburger, she wouldn't, of course, because she probably have a healthier lifestyle than this one. But the difference is almost 400 calories with no gain of weight, because she burns much more than this girl because of the muscles. So that's the reason to build muscles. And it's not only the difference in basal metabolism, but it is the difference between the regular activity and the sedentary lifestyle. Because when this girl has a sedentary lifestyle, her basal metabolism is multiplied by just 1.2. So basal metabolism in inactive girl multiplied by inactivity, she burns around 1,070 calories per day. It's quite normal range in this body composition. But this girl with muscles have moderate activity. It means 3 times per week she do some exercise, and her basal metabolism is improved because she has muscles, and her daily amount of burnt energy is necessary to multiply by 1.55. So you can see that the number is much more higher than in this case. So the difference is almost, it's more than 1,000 calories, and it means she could eat much more than this girl, but she wouldn't, of course. So that's the reason why we have to force our patient to exercise to build the muscles, because they burn much more energy than before. So we here in Czech Republic, we have some recommendation for physical activity, which is translated from WHO. So we will continue step by step for this recommendation. And it's not only for patients with diabetes, it's for everybody. We could combine aerobic activity with anaerobic one, and the amount of the physical activity and the intensity is as we show here. So about moderate activity, we should have 150 minutes per week. It's not necessary to exercise every day, but there shouldn't be a bigger break than 2 days. And activities, which is aerobic, means swimming, walking, slowly running, cycling, and so on. And when we would like to recommend this activity to some patients, we could describe it that it leads to shortness of breath, but you can still speak and still talk during this activity. When the patient or us are able to do high-intensity activity, which means, for example, climbing stairs, cycling, running, and so on, it's necessary to do much less minutes per day than in this case. And the activity of high intensity could be described as rapid breathing when the patient is unable to talk. But 150 minutes seems like quite few. Do you think it's easy to fulfill? Do you have 150-minute activity per week? Who think? Perfect. You are perfect, but you are not the common people. And if we plan for our patient, we describe it like 4 times per week in their diaries, for example. And when we recommend physical activity, we inform them that it's necessary to combine aerobic and anaerobic activity. Anaerobic means resistant muscle strengthening, and it's necessary to do this at least 2 times per week. And the muscle strengthening activities, it's not necessary to force them to go to the gym or to the fitness center because they wouldn't. But it's enough to be at home in front of TV and do some exercise, like, for example, interval training, or the internet is full of this recommendation, or it could be used some stuff like overballs or stretching bands and so on. So it's not such a big problem to have some muscle strengthening fitness. But if we add that to our diary, it's quite filled already. So we see that physical activity is not easy to fulfill the recommendation. And we should also add some balance and flexibility exercise, especially in elderly. And it doesn't improve the metabolic parameters, but it's important for them to prevent the sedentary lifestyle and for them to maintain joint flexibility. So it's yoga or some stretching or dancing, whatever, and it improves joint mobility, posture, and also reduces the risk of falls. So if we add this, this is our full diary, and there is no other space for working or for whatever else. So that's the recommendation. And for everybody, not only for patients with diabetes, it's recommended to reduce time spent in sedentary activity, for example, being in a congress. And it's recommended every 30 minutes to stretch a little bit, or to stand up and walk a little bit, or do some light activity for a while, because it improves our glucose metabolism. If we recommend some physical activity, we have to be aware that there could be some risk, especially in patients who are treated with glycemia lowering therapy, especially insulin, because they could get hypoglycemia, but even hyperglycemia, low or high glucose. There is also effects of some medication, for example, medication for blood pressure or statins for cholesterol and so on. It could involve physical activity, and we have to be careful of orthopedic injuries, especially in patients who are obese. It could be damage the joints, and this is the thing that we are afraid the most, that obese people are in higher risk of cardiovascular diseases and myocardial infarction. So we screen for cardiovascular risk factors like symptoms, history, smoking, and so on. And if we think that the patient is in a high risk, we recommend some stress tests or functional imaging, like ergometry, which is quite easy to do, and this examination is recommended for all obese patient, which is in the condition, which are the majority of them. Here it's quite depressive information and quite frustrated one. Here is a nice study from Lancet from 2023, and it's comparison of intervention for reduction of obesity. And here you could see which is the most effective, and the majority of patients who lose around 30% of body weight in surgery, it's the best thing we could do, or the most effective thing we could do for obese patient to reduce weight. But in comparison with lifestyle intervention, you can see that majority of patients lose 0 to 5% of body weight during the lifestyle intervention. And here we can see the new therapy with GLP-1 receptor agonist, and you can see that the majority of patients lose around 15 to 20% of body weight with this therapy. So in comparison with surgery and with GLP-1 receptor agonist, lifestyle intervention is really, really poor for reduction of body weight. So there is a question from a lot of our obese patients, why to exercise if it's so ineffective? Because it's known that under 10% it doesn't work. If they don't lose weight under 10%, it doesn't work. They don't grab the cardiometabolic benefits from that. And there are a lot of studies with lifestyle intervention that if it works, it doesn't work for long, because if the intervention is stopped, their body weight go back to the first point, to the type 0 position. So when it works, it doesn't last in obese patient. It's frustrating, isn't it? So why should obese people exercise? What do you think? If we have GLP-1 receptor agonist. For muscles, perfect answer, because nowadays a lot of doctors skip this lifestyle intervention and behavior intervention, and they directly give the patient the prescription for GLP-1 receptor agonist. But it could be vice versa, that with the prescription for GLP-1 receptor agonist, they should teach them and educate them that it's necessary to start physical activity with muscle strengthening to prevent the muscle loss, because they don't want to reduce them to this form. They want to reduce them to this shape. Not even it looks better, but it's healthier. So the pharmacotherapy should be combined with activity to maintain muscle mass, and of course with protein diet, because they lose weight with lower taste for eating, and they choose wrong food, and they should increase the amount of protein to maintain muscle mass. And the second bad idea is to stop this treatment, because we know that if they took GLP-1 receptor agonists, they lose weight quite heavily. But if they are short of money or they decide to stop the treatment, their weight go back, not almost to the normal, but decently. But what is the idea? The idea is that if they lose weight quite rapidly and they stop the treatment, they gain the weight back. But do you think they gain back the muscle mass? No, they gain just fat. So the end of the story is that they lose weight, they gain weight, but they lose weight, fat with muscles, but they gain back just the fat and a lot of money. So that's not our goal, so that's the reason why they should exercise. Because the percentage of fat matters, the muscles are much heavier than fat, and we think that we will need in a short future something to distinguish between the muscle mass and the fat mass, and some of this stuff for measuring is, for example, biometrical impedance, which is stuff that measure the percentage of mass of fat and muscles. So how to motivate for physical activity? We should recommend the patient what they want, because if we force them to run or to do something they don't like, they wouldn't do that. So we have to discuss it. We have to actively involve the patient in the education and to plan. The planning is most important in the physical activity, and we should force them to increase the amount of activity gradually, not to prevent some injury. To evaluate the effect of treatment if they took some pills, for example, anti-diabetics or insulin. And we should evaluate the risk of comorbidities and what to use and how to motivate. It's not easy to motivate somebody who doesn't want to do any exercise. So maybe by saving money, because if they pay for expensive treatment, they could save money, which means by reducing the dose of the expensive incretins, by health and social benefits, of course, by increasing self-confidence, because patients who are fit, they have higher self-confidence. By competitions, there is a lot of mobile phones that could count steps. So I advise them to do a table on the refrigerator at home and to write down every day each member of the family the amount of steps per day. Or by coaching. Coaching is the best or good way to motivate for physical activity, or by setting a plan or any other way we could imagine. So, in conclusion, the golden rules for physical activity. Some activity is better than none, of course. Every step counts. Every minute counts. Every minute of activity. The more, the better. Never too late to start. Start today and plan. Thank you for your attention.